Morning, everyone. Simply the gift, man. Like I said, I'm going to make a part two video about the general blood collection equipment. So the first video I didn't finish it because, my battery was low. There's no electricity, so I had to cut the video. You know, so um, like I said, this is a part two basically. Right now, I'm just at the train station waiting for a train so that I can get my day started. You know, I'm supposed to be on a train now, but it left me. I was there. Since it left me, let me just do this part two video, right? Because I thought I was gonna do it on a weekend, but sure, yeah, what a crazy weekend it has been. So I couldn't do the video. I was tired and yeah, So where did I end? So I ended where I spoke about gloves and glove cleaners. I think that's the last general blood collection equipment that I spoke about on the first video. And yeah, my phone was about to switch off. So I was like, there's nothing I can do. There's no electricity. So I'll just do a part two video. So, yeah, uh, I'll continue from there. So, disinfectants is, the following blood collection equipment after gloves and glove cleaners. So, what is a disinfectant or what are disinfectants? So, disinfectants basically are substances, right, that we use, you know, to clean surfaces, mainly surfaces, not instruments, because all the instruments that we use, like whether that's your needles, etc., we discard them, you know. So, disinfectants basically are chemical substances that kills and inhabits, right? Um, Actually, it kills, right? Yeah, chemical substances that kills um, you know, microorganisms on the surfaces of instruments or what's this? All surfaces, all right? So those are disinfectants. And I'm gonna make like a separate video again where I dive deep into the details of that. Since disinfectants are closely tied to um, you know, bodily fluid cleanup, right? Or spills. So when I make that video, then I'm gonna elaborate more on disinfectants. But now, for now, I'm just gonna limit it to, um, the meaning or what disinfectants are. So your bleaches, your microtols, all those disinfectants that we use to clean the surfaces and instruments. And I'm going to talk about antiseptics, right? So the word antiseptic means free from pathogenic contamination. No, no. So there's a difference between antisepsis and asepsis. Sorry, I made a mistake there. So asepsis, right, is free from pathogenic contamination. So that's what asepsis, A-S-E P-S-I-S, yeah, asepsis, right, which is completely different from antisepsis, right? So antisepsis or antiseptic. So antisepsis are basically substances that prevent or inhibit, you know, actually, by definition or by meaning, um, are substances that prevent sepsis, right? And sepsis basically is a condition uh, in which there's a presence of microorganisms or their toxic products within the bloodstream. So, what an antiseptic does is it inhibits and prevents, the growth of those microorganisms, right? But it does not necessarily kill them. So, we use different antiseptic, you know, substances to clean the skin prior to any procedure that's going to be performed, to actually minimize, prevent, or even inhibit the growth of those microorganisms. So um, the commonly used one is the 70% isopropyl alcohol, which we use to clean, the site prior to a blood collection procedure, whether that be your venipuncture, capillary puncture, or arterial puncture. But there's also different kinds of, antiseptics, right? So you get that 70% isopropyl alcohol. You also get the 70% ethyl alcohol, and what you get benzyl chlorium. What is it called? Benzyl conium, something like that, chloride. And then you get your chlorohexadiene gluconate. You get your povidone iodine. You know, the pronunciation doesn't matter as long as the word. But povidone iodine or iodine, and tincture of iodine or iodine, and we use different antiseptic depending on the procedure that's going to be performed. So if you're doing a blood culture collection, right, you would most likely use the chlorhexidine gluconate, right, which is that chemical substance that's found in a biotin, right. Just gonna show you that bottle that we use, probably on a separate video, etc. So it depends on the procedure that you are performing, right? So the procedure that you're performing determines which antiseptic product are you gonna be using. Whether you're gonna be using the 70% isopropyl alcohol, 70% ethyl alcohol, povidone iodine, tincture of iodine, benzalkonium chloride, hexodine, uh, what's this? Ah, my ears. Sorry, my nose. Sure. Seho. Uh, you know, uh, yeah, it depends on the procedure that's being performed, right? And then followed by that is your gauze pads, which we don't use a lot. We only use them when we're performing the blood culture collection, right? So when you perform the blood culture collection, there's a pack that comes with, blood cultures, right? So that inside that pack, there are things, right? If I can put it that way. So you'll find your gauze pads, you'll find your linen, you'll find your sterile gloves, you'll find your forceps, you'll find your biohazardous plastic bin, you'll find your 4 or 5 gauze balls, right, that you use to clean the skin with after mixing those gauze balls with the biotin. So that, and then um, yeah, but we don't normally use the gauze pads, uh, you know, but they are most preferred because the gauze pads, right? They are manufactured with a material that absorbs, the blood, right? Compared to the cotton wool ball, right, which tends to stick to the side and make cotton wool fibers, which will then let's say you apply the cotton ball or cotton wool ball, whatever you want to call it, it's cotton ball, yeah, cotton ball to the side, right? And then you remove the cotton ball. What tends to happen is the patient rebleeds, right? It means that the platelet plug, gets disrupted, right? And it's not recommended for usage, the cotton ball, but we mainly use them, I think in a corner, it's a matter of they are much cheaper compared to the gauze pads, right? And then what else? Bandages. We barely use bandages. We mainly use plasters. To be quite honest, we barely use bandages. So yeah, also bandages. You apply them once the site has stopped bleeding, and etc. So that the patient does not bleed under the skin. So that's why you need to ensure that bleeding has stopped first before you can actually apply the what's this plaster. I understand, but we barely use bandages. But they also counted as part of general blood collection equipment. And then followed by that, which is the most important thing, is your needle and sharps container, right? Needle and sharps disposal container, right? So there's a bin that you know we use you know to discard any sharp or needle object or objects, right? And those bins are you know rigid, number one, right? The ones that we use are yellow, right? For the easy identification, right? To tell when the bin is about to reach you know the full volume of the container, if I'm making sense. Understand? So as you discard or dispose those needles, you're able to see how far the contents of you know uh, the material that's been disposed is at um, in comparison to the volume of the bin, you know so that's why it has that yellow color for easy identification to tell when the bin is full, right? And it also needs to have a biohazardous sticker, right? That's very important because uh, all the stuff that you're disposing there or inside that bin is infectious substances. So that's why it needs to have that the biohazardous sticker. And biohazardous basically means, I think, are substances that cause harm to human health. That's what biohazardous means. So that, and then what else? They also have like locking lids, right? That red locking lid that you use to seal the contents of the dustbin or bin or container once it's full. And it's once you close it, it cannot be opened, right? And there's a reason for that, prevent needle stick injuries, etc. So once you close that lid, it cannot open anymore. Valile valide. You know, and they are also puncture resistant, like as pobogile sasinto, because obviously a sharp, you know, and needles inside that container, so it has to be puncture resistant. Also for that reason, to prevent what's this needle stick injury. And then the last thing, they are leak proof. So our vuzi anyway, name or etc. you know And yeah, that's it about the shops and needle disposal containers. And then you get things such as, what's this, your pen is very important, especially for the documentation of the information of the patient. So that is, yeah, is important. A pen is very, very, very important, like very, very much important. You see, I even have my own pen here for that reason, because a pen is very, very important for the documentation. And then followed by that is your timer. I don't want to say watch. Let me just say timer, right? That you use to time certain tests, such as your bleeding time and your glucose tolerance test, also known as GTT, right? So those are your timed tests that you do within your scope of practice, right? And then the other things, we don't normally use them. Your slides, right? To make blood smears, we barely use. Actually, I have never even used one. You know, so that's how I'm saying. I don't think that we even use one. So um, yeah, I think that's all the general blood collection equipment. If I've left something out, you can comment in the comment section. If you need clarity on something, anything, you can just leave a comment. Then I'll respond to those comments as soon as possible. And thank you, and hope that you have a good day. It's Simply the Gift Man. Thanks.